kind of work my way around the different vessels and everything else, okay?
Okay.
And I'll kind of do a little, tell me what it is, and we'll kind of see how it goes from there. Okay. So first off, this, what closes the heart is pericardial sac or pericardium, either one works. The outermost, what you would look at, what part is that? Parietal. Technically fibrous if you're wriggling on the outside, but parietal. And then on the inside, the shiny material is the visceral. Okay, which is also known as the...
Sorry?
Not endo, but...
Epicardium.
Epicardium. Okay. Then the actual muscle is myo, and then the lining on the inside. Endocardium. Okay, good. And somebody punctured this here? Oh, gee, what's going on here? That wasn't there before.
No, there's a lot that's apparently different from Friday.
Wow. Okay, I gotta find out what's going on. All right, this blood vessel right here.
Coronary
artery. Okay, the sinus is in the back.
On the back.
Okay. All right. So, looking at it here, this chamber here is the right atrium. This chamber is the right ventricle. This thick one here, ventricle, and then the back here, left atrium. Okay. This artery coming out here. Pulmonary trunk, which then splits into the right and left pulmonary arteries. This one here, ascending aorta, and when it begins to curve, aortic arch. First branch coming off here, brachiocephalic trunk, or artery, either one. Make sure you put either artery or trunk, okay, one or the other. This one heading up to the head, common carotid artery. This one going down here.
The right subclavian
artery, and then once we get to it in this area here is the
right
axillary artery, and then as it continues down here, right brachial artery, as opposed to the left brachial artery, which is on this side. Okay, now let's see the venous circulation on this side. Let's start with this guy right here. This is the cephalic vein. Right cephalic vein. Okay. Its companion on the medial side is the right basilic vein. Not this, that's a nerve. This guy. Then this one crossing here between the two of them.
Antecubital.
All right, antecubital or median cubital vein. Okay, right side. And then this vein, which is disappearing down in there, is the right, the right brachial vein. Okay. The basilic vein joins the brachial vein, okay, in the arm right about here. The brachial vein becomes then the, right in here, axillary, okay, not auxiliary, axillary. Okay.
I know, I keep saying it like that.
That's all right, that's okay, everybody does. And then the axillary vein becomes the subclavian vein. Coming in here, joining the subclavian vein is the cephalic vein. Okay, that's one way to tell them apart. Cephalic vein joins the subclavian, the basilic vein joins the brachial vein. The subclavian vein then here becomes the brachiocephalic, exactly, joined here by the jugular vein, specifically the internal jugular. It's the big one.
And the external is this little
is the little guy, what's not him. On this side, I think it was torn away.
Oh, okay.
But on this side, it can still be, it's also torn, unfortunately, but it can still be seen. This guy right here.
Oh.
Okay. The other half is in there someplace.
Little as in length.
Yeah. Yep.
I was
this
thinking
narrow diameter.
Okay.
Yeah. And yeah, there's, I don't know, somebody manhandled this thing here between, I don't know what's going on. Okay, so let's see. Then we had the jugular and the subclavian vein come together to form the brachiocephalic vein, both left and right. Okay, mirror image symmetry. The two brachiocephalic veins join into the right, the SVC, which goes into the right atrium. Okay, now blood flow. Right atrium to the right ventricle passes which valve? Tricuspid valve. Okay, then goes out the pulmonary trunk, pulmonary artery, either one, goes into whatever lung, comes back via the not the pulmonary arteries, but the pulmonary veins, okay, to the which chamber? Left atrium back here, okay. And from the left atrium down to the ventricle, passing which valve? Bicuspid or the mitral valve, either one. Okay. Then out the aorta, which valves are right here? Semilunar valves. Okay, then we go out here, we did this. Second branch off the aorta, this guy is the left common carotid, not coronary. Coronary is on the heart itself. Okay, think neck, carotid. Okay, common carotid. And then the third branch is the left subclavian artery, and then we have a repeat on this side of what we had over there. Okay, all right. Then let's say take the let's say we bypass all of that. Then we take the descending aorta through the it's behind the lungs, back through there, and then the descending aorta comes out down here. And move this out of the way. The first major branch of the abdominal aorta right here as you come out of the diaphragm, this little stump, is the celiac trunk. The artery branching this way going toward this organ is the splenic artery, and the one going that way is common hepatic artery. Common hepatic artery. Then the next major branch coming off below the celiac trunk, this is the superior mesenteric artery, feeding what structures? Small intestine primarily. Okay. Then coming down, we have two arteries going left and right to these guys. Those are the renal arteries. And then we've got further down here, we have this guy, which is the inferior mesenteric, which feeds the large intestine, mostly this. Okay. Then the abdominal aorta terminates at a split, and the bifurcation is the left and right common iliac arteries. Okay. Then from there, there's an artery which dives down into the pelvic area. That is the left and right internal iliac arteries. The other ones which stay more to the superficial area, like this one, are the left and right external iliac arteries. As soon as you cross out of the body cavity through the inguinal canal and into the leg, this becomes the femoral artery. And then the one that dives down deep toward the femur itself is the deep femoral artery. So we have just this guy right down here, diving down into the body of the leg itself.
Not the word deep, but the femoral artery.
Yep.
So that one is added?
I forgot to add that last time. Deep femoral or femoral, either pronunciation. Okay. All right. And then venous circulation, starting here, superficial vein that we talk about, like this one, is the greater saphenous vein. There was a companion on here or someplace. The greater saphenous vein drains the lower limbs, okay, along with others, but this is the main drainage passageway. The greater saphenous vein joins the the femoral vein. The femoral vein is coming up through here, parallels the femoral artery. And when was that done?
Yeah.
All right. So the femoral vein, as soon as you cross into the body cavity itself, become the
Iliac.
which iliacs?
External.
Right, left and right external iliacs. Okay, just like the external iliac arteries became the femoral artery, the femoral vein becomes the left and right external iliac vein. The vein coming up from the pelvic area joining the external iliac is the internal iliac vein. Together they become the common iliac, just like the artery, common iliac veins left and right. Those are a little harder to see because of all this stuff that she's got here. Okay, so you have to move this a little bit gently and you'll see pieces of the common iliac veins left and right. The two common iliac veins will join together and form the the IVC. inferior vena cava, which goes all the way up and empties into the
Right atrium.
right atrium. Okay? Along the way, we have the right, where is it? That's a ureter.
The gonadal?
The gonadal
It's
vein.
broken.
Yeah, I heard, but there should be a stump of it here someplace, no? Oh, here it is, this little bit.
that little bit.
Okay, so that is the right gonadal vein. What's left? It used to be all the way down to her ovary over here.
Yeah.
Yeah, there's the rest of it. It's up like so. Okay, I don't know how that got torn. There also is a left gonadal vein, which was torn in the process of dissection, coming from the gonads also, but now going to the left renal vein. Okay, so there's asymmetry there as far as those are concerned. All right,
Left renal versus the FCC.
goes right into the IVC
Or
down
IVC.
here. Yeah.
Sorry.
Okay, that'd be pretty high up.
Yeah.
Okay. So from the kidneys, we have the left and right renal veins. Okay, joining the IVC here as well. Okay. The other one is the hepatic portal vein, which runs from all of the intestinal viscera, the pancreas and the spleen. It drains all of that and goes into the liver. It is essentially this tube. It's been kind of partially cut here, I think. This tube right here.
The white one?
Yeah, this white cord.
Okay.
Yeah.
That would the what?
Hepatic portal vein. That's the, or is it this guy? What happened here? See, no, wait, but that's not it. That's just tissue. Okay. This guy right here. That's the, it's kind of buried in the tissue there. That's the hepatic portal vein in there. Okay. If you trace this back, it's just attaching mesentery to the superior mesenteric artery over here.
And where was the hepatic artery?
There is no, well, there is, but it's buried. You have to take the liver out. Yeah, it's a little thing like this. Okay, that's what drains the liver into the IVC. Okay, and what? That hole wasn't there before either. That was torn. Okay,
Or goes to the liver.
From the intestine.
that's about to separate there all of a sudden.
Yeah, I was like, hold on.
Okay. Okay, that should be all the blood vessels that are on the list, I believe. Okay,
Did you do the top?
For the practical,
I did already. Yeah.
for the practical, like especially in here, are you gonna be able to pin things, or are we like during the practical? Are we gonna have to like move stuff around?
If all goes well, we kind of move and stabilize and support things out of the way.
Okay.
With non-labeled pins.
Right.
You can slightly here and there, just a little bit to be sure. Okay, but no moving anything like that.
Okay.
All right. If you want clarification, then you'll call one of us over, and then you can say, what do you mean this or that, and we'll point, or say where the pin is in or something to that effect.
So we did add the common hepatic.
Yeah, I added the common hepatic artery, the splenic artery. I had external and internal jugular, but since the other one got torn, I may not go that far. But deep femoral needs to be in there list. Right.
Where's the common hepatic?
Yeah.
That's the one that's under the liver?
No, the common hepatic is a branch off the celiac trunk. It is this one right here. Okay, this main branch. It also branches off into the pancreatoduodenal, which is this little guy. But the rest of it, the hepatic artery proper, is this one, which eventually goes into the liver. It actually attaches right about there. Okay.
And where's the splenic?
The splenic artery is this one here that's going this direction. And if you follow it, it goes right into the spleen. Okay, it's this one.
Okay.
Okay.
Oh, off of the
Off the celiac trunk. Okay. So from anatomical position, the celiac trunk is right here centered. The artery that's going this direction is the splenic, the big one. The main artery going this direction is the common hepatic artery.
Okay.
Okay.
And the superior mesenteric?
Is this one right here?
Is that what you're showing
This
now?
guy right? Yeah.
Where did I miss? Hold on.
Okay. We'll wait. You see a piece of the celiac trunk right there, and this one here is the superior mesenteric
And the inferior is way
down
down.
here. So this is the superior mesenteric
that's
artery
it.
right here. Yeah.
Underneath the lungs, that's why we didn't find it. And the cephalic trunk
Is a piece of it right there
Above
the stump.
So it is superior
It is
to the-
superior.
okay.
Exactly.
easy enough.
Superior to the superior.
I'm gonna have to come around the other direction.
Oh,
Sorry.
to see the same one?
Yeah.
Okay, I can back up a little bit this way.
Oh, it's okay.
Okay. So this guy here is the superior mesenteric artery.
Okay, because it goes to
It
the
goes into the mesenteries,
Right.
small intestine,
Of the
and
small
then
intestine.
the celiac trunk is the stump. That's right under there where my finger is.
so it's that
Yeah,
thing right
it's
there.
only about the epic.
Okay.
This little guy
Okay.
right there.
Oh, I see it.
All right. So I mean, if a pin is right in the center here or off to one side like that, then it's the celiac trunk. Okay.
And then it branches into your
Splenic artery,
splenic artery.
which is this one disappearing down there.
Okay,
It goes to the spleen.
there it is.
Looks
This
like a
one right-
worm at this point. The one you're holding.
This is the splenic, right? Okay.
And then a common hepatic artery, which is this section right here.
Okay. Because the common hepatic would go to.
Eventually becomes the hepatic artery proper going to the liver. The connection is like that.
Okay.
This
it's
other one
broken.
coming off is the pancreatoduodenal artery.
Okay.
Pancreatic, because it's going into the pancreas.
Okay.
Okay, then another branch goes into the duodenum.
Okay.
And then you said the femoral iliac next to the external iliac.
Iliac veins, right?
And which one did with the internal?
Say again?
Which one did with the internal?
The internals come up and meet the externals. And once they join, they form the common iliacs.
But the greater saphenous doesn't
Is down here in the leg.
connect to.
Connects to the femoral.
Okay.
Okay. All right.
Did you get the internal iliac
Vein? Yeah, they're buried down in there.
Okay.
Did you see one?
Did we? I guess we didn't get that far into it. Huh? I
You
didn't
should
see
be
one.
able to. Let's see.
We did see the internal iliac or the external iliac.
Yeah, they're out here.
Iliac.
The internal iliac, let me see if I can find it. Is that it's external?
It's okay. I'm little.
Yeah, it's down there. It's going down that direction. Where my
Oh, I
finger
see
is,
it.
Down
Yeah,
in there.
okay.
Here's the
Okay, so it's on the outside.
external. Yeah, there's the
All right.
internal iliac. And then where these two come together, right up here is the common iliac, which
Right.
is only about yay
It's-
big.
yeah,
at
we
this
noticed it was
particular
very
one,
short on her. We expected it to be a little bit longer.
Yeah,
and
typically
noticed-
they are, but her torso is so short, top to bottom.
Okay.
So correspondingly, a lot of her vessels, segments are a little shorter.
Okay. Did you see
Just
it?
No,
Okay. If it's not clear on that side,
It's
it might be
going
clearer on
way.
this
It's
side.
right here.
the common iliac.
The common is buried under there.
See, and there's the external right there, or the internal.
Where
so basically the internal will be deep.
Yeah, the internal runs deep into
And
the.
it looks-
comes
it
from
looks
the
like-
pelvic cavity.
It looks like
It's.
this one's
even
coming
worse.
off.
Might be hard to tell the difference between the vein and the artery when they're way down in there.
Yeah. Okay, here's the external iliac vein on this side.
That's the external.
This is the
iliac?
external. It's the same as the
Okay.
femoral.
And this,
Right there.
and right next to it is.
This is the artery.
Artery.
External iliac artery. The
Is that the internal artery right
internal
there?
iliac artery. Yes, this is the internal iliac artery.
Okay.
The internal iliac vein is right next to it. It's almost buried where my finger is, but it's on this side of it.
Okay.
Okay. It's kind of a look there. Maybe hold a flashlight in it.
And
Feel
what's
kind of a thing.
What's that?
This one.
Yeah.
This is the ureter
Okay.
from the kidney.
Okay.
That's for
That's the
that's for practical
femoral.
number 3.
Okay. So don't worry about that.
Don't worry
But know what it is.
Yeah, don't confuse
don't
it.
get it
That's
confused.
that's your stomach.
Is this the